Let's be honest, modern medicine is broken. Patients are dismissed, doctors are exhausted, and mental health care is decades behind. So it's time to disrupt the status quo, to challenge a system that fragments care, dehumanizes patients, and burns out clinicians. I'm Dr. Georgine Nanos, and this is The Kind Revolution, a podcast about breaking old paradigms, rebuilding medicine with compassion and science, and reimagining what healthcare can be when we finally get it right, because change is here and it's starting with us. Welcome to the revolution.
Welcome back to the Kind Revolution podcast. Today we are tackling one of the biggest shifts in mental health treatment, the move from traditional TMS to the accelerated protocols. It is a story about science, stigma, and speed, and about how we redefine what getting better can look like. So, Dr. Nanos, let's start at the beginning. What is traditional TMS?
Thank you. That's a great place to start. Traditional TMS, transcranial magnetic stimulation, has been FDA approved since 2008 for major depression. It works by sending gentle magnetic pulses into targeted areas of the brain, specifically the dorsolateral prefrontal cortex, which is usually underactive during depression. And we have decades of safety and efficacy data showing that it helps people who haven't responded to meds. And that's huge. It's non-invasive, non-systemic, and it doesn't mess with your hormones, your liver, or your kidneys, or cause any side effects.
Wow, that sounds amazing. So what's the catch?
So the catch has always been time. In traditional TMS, it usually requires 30 to 40 sessions, and that's how the FDA first approved it. And those sessions are still administered once a day, 5 days a week for 8 weeks. And so originally, each session used to also last quite a long time, about 40 minutes. But now we have had an evolution in the amount of time it takes to do TMS. And newer approaches like intermittent theta burst can bring that down to just 3 or 4 minutes. But still, it's 40 trips to the clinic and 2 months of lots of scheduling logistics, which makes it really tough for a lot of patients to actually follow through and complete their treatments in their busy daily lives.
Yeah, because for a mom who's, for example, juggling school drop-off or a professional on a tight work schedule or someone who lives very far off in a rural area, that's a huge barrier.
Exactly. So imagine living, say, 2 hours from the nearest TMS center, and that's 4 hours of driving back and forth 5 days a week for 2 months. That's really hard for a lot of people to do. Or being suicidal and told, great news, you can get relief in 6 weeks if you can stick it out. That's just not realistic for so many people.
And so I have heard that dropout rates can be super high. People give up before they even get to the payoff.
Yes. So a lot of studies have shown that even up to 1/3 of patients drop out because of that burden of time to feeling better. And for people in crisis, that delay is really dangerous. So while traditional TMS is very effective and safe, it's not always accessible or even a reasonable option for everyone.
Okay, so I have an obvious question, but if traditional TMS is safe and works, how do we speed it up? Because rushing mental health treatments has a mixed history, right?
Exactly. So if you look at ketamine, for example, it works really fast and people can feel better in hours, but the durability is not always there. And we still don't know what the long-term side effects are for repeated use of something like ketamine, and same with psychedelics. They're promising, but they require intensive prep, long sessions, and then integration afterwards.
And then there's ECT, right? Electroconvulsive therapy. That's rapid too, but it comes with anesthesia, seizures, and memory loss.
Right. So historically, these fast fixes have carried really big trade-offs, but TMS is so different, and its safety profile is also remarkable. This is the safest treatment we have in all of medicine for not just depression, but a whole host of mental health disorders. And really, the most common side effect is just a mild headache or scalp discomfort, which relieves itself after either a day or less, goes away pretty quickly. Serious risks like seizures are incredibly rare, even more rare than if you were to take a medication. So that gives us a big cushion of confidence to say, what if we just did more of it, but a lot faster?
So it almost sounds like physical training. If I'm running sprints, I can compress more into a week than spreading it out for 2 months, as long as my body can obviously handle that load.
Exactly. TMS is like training the brain. So we give neurons repeated nudges to strengthen these healthy pathways. And the question scientists asked was, can the brain handle those nudges closer together without frying the system? And the answer, surprisingly, was yes. Not only could they do it, they were actually giving better results.
Okay, that kind of leads us to the Stanford and the SAINT protocol. Can we unpack that one? It feels like the moon landing moment for TMS.
It really was. So SAINT, which stands for Stanford Accelerated Intelligent Neuromodulation Therapy, said that what if we take those 6 to 8 weeks and compress it down to 5 days? And here's how it worked. It's 10 sessions a day. Each session takes about 3 minutes thanks to intermittent burst. It's spaced roughly 50 minutes apart. And the patients are in the clinic all day, so Monday through Friday. They're basically spending 40 hours in the clinic. And by Friday, they've received the same dose as 6 to 8 weeks of traditional TMS.
That sounds really intense. 10 sessions a day sounds like a full brain boot camp.
It definitely is. And patients often describe it like running a marathon in sprints. But here's the kicker. In their early trial, they had incredible results. About 70% of patients achieved remission, which is staggering when you consider typical meds really only get there about 30 to 40% of the time.
Wow, that's incredible.
Exactly. So the speed was remarkable. And some patients reported their suicidal thoughts lifting within 24 to 48 hours, which is life-saving.
So with condensing it into the 5 days, are there different side effects? Like, how are the side effects different?
Surprisingly mild, and really the exact same ones that we see with traditional TMS. Maybe a little more intense of the headache piece of it, but again, that resolves quickly with over-the-counter medications. And obviously, because it's such an intense process, the fatigue tends to be a little bit more pronounced for patients. So they do get pretty tired at the end of each day. It's a long day in the clinic. There's no increase in seizures, no new scary complications. And yeah, it's a pretty remarkable outcome.
Yeah, it almost sounds too good to be true. Did people question these results?
Of course. Skeptics asked, is this just a Stanford effect? Can other clinics replicate it? Will insurance ever cover 5 days and 6 weeks? And those are real hurdles. But in 2022, the FDA actually cleared SAINT, making it the first FDA-approved accelerated TMS protocol. And so that gave the accelerated TMS field a whole new brand of legitimacy.
So essentially, traditional TMS proved safety and proved speed.
Exactly. And so once that door opened, the question became, can we go even faster?
Okay, so that kind of brings us to 1-day, or known as 1D. This is the part everyone I feel like is listening or leaning into, but what is it? How does the day actually run? And why the neuroenhancers?
Okay, so 1-day or 1D is a single day TMS regimen designed to deliver a
Question, can we say, or should we be talking about this if they're trademarking it with the neuroenhancers?
Yeah.
But I should know, since we're not really using the neuroenhancers, if we want to talk about it.
1-day is a single day TMS regimen designed to deliver a full therapeutic course in about 10 hours. Think clinical marathon, intentional pit stops, and a carefully primed brain.
So can you walk us through the design, like I'm on the schedule?
Yes. So patients arrive very early in the morning. We start about 6 a.m. And after doing brain mapping, we place a cap on the skull to mark the treatment spot. And usually it's the left prefrontal cortex, or we might target another area. And then we deliver 20 short intermittent theta burst sessions across 1 day. So basically the full 6 weeks of therapy compressed. Now, in the original study, we also added 2 medications, neuroenhancers, almost like fertilizing the soil before planting. So these 2 medications were designed to help the brain respond more efficiently. They were D-cycloserine and the generic for Vyvanse, which is a stimulant to help people focus throughout the day and stay on track.
Okay, so wow, 20 sessions in 1 day. That's 6 weeks in one sitting.
Yes, and then we run this cadence. It's 3 minutes of intermittent theta burst, 25 minutes off, take a stretch, take a snack, take a walk, repeat. And then the staff are constantly keeping the patient on time, making sure that they're comfortable, that it's okay for them, and that they're feeling well.
Aside from the study, I know that your clinic, Kind Health Group, has performed the most amount of 1-day treatments in the world in an actual clinical setting. How has that performed?
Yeah, so in 2024, we published our community case series in the Journal of Biologics. We had 32 adults with medication-resistant depression. These patients had really severe depression. Every single patient completed all 20 sessions in a day. There were no seizures, no real significant complications beyond, like I was saying, some temporary scalp soreness or a headache. And we logged an average discomfort of about 5 out of 10. Again, sometimes with the higher motor thresholds, patients would sometimes experience discomfort with other devices. So several of them took some over-the-counter pain relievers and kept going, and the overall safety outcomes were excellent.
So what about the outcomes?
Really incredible effects that we weren't even expecting. The effects build after the day, not during. So most people don't feel fixed that same day. The curve looks like an exponential glide downward in symptoms over about 4 to 6 weeks. So they're seeing incremental improvements over time. And by week 6, so 6 weeks after the treatment, and again, keeping in mind they're improving every single day, we are seeing a 90% response rate, 90 to 93% response rate, depending on whether we're looking at depression or anxiety, and then about a 72% remission rate. And by week 12 and even week 16 now, that remission rate really held its place, which is really remarkable. This is even better outcomes than the SAINT trial. And when we define response and remission, we define response as a greater than 50% reduction in your symptoms.
All right, so you have about 1 day in the chair, and then you have about 6 to 12 weeks where you're just constantly seeing improvement.
Exactly. So patients who were on medications stayed on their medications beforehand. A lot of them did have comorbid anxiety. The age ranged from 22 to 62. Every single one of them was able to get through it in a single day. It was not a randomized trial, it's important to say, but it's very pragmatic and very encouraging. And now, all over the country, a year later, this particular approach, this one-day protocol, is being studied at every major university institution in the country that's looking at TMS. So we're seeing it being studied at UCLA, at Stanford, at Harvard. It's now being measured as a possible just finish at Harvard.
So what have some patients been saying after they've completed this treatment?
So here are some of the responses. One of our patients was a working parent in her mid-40s. She felt she couldn't banish for 6 weeks to take the time off, but one day she could do. And at week 1, there was nothing dramatic. At week 2, she was feeling like everything was getting easier in her daily routine. And by week 4, she felt like her kids were seeing her old self again. Another older adult on multiple medications just felt like adding another pill wasn't an option. And 1D helped lift the fog without having to add more to his prescriptions. We had another young veteran with anxiety and depression. By week 3, the panic felt like it was starting to subside, and that volume knob started to finally turn down. So really outstanding results that we continue to see almost every day.
Yeah, that's the promise. 1 day, and it seems easy to get through it, and you have these amazing long-lasting results.
Yes, and in fact, what we've been able to do with some of the newer devices we're using, for example, we are now using BTL's device called ExoMind, and because of the advanced technology in that device, we are seeing better and faster gains, and we also no longer need to use those medications for our one-day protocol. So we're seeing the same type of results without having to complicate the whole system by doing these medications in the morning. So it's even better.
Yeah, wow. Obviously, our goal too is to help us place 1D on the map. And we've got traditional daily TMS, which takes 6 to 8 weeks. We have the SAINT, which is the 5-day accelerated protocol. And now we have 1D. So what should a listener or someone who's listening expect to feel, and when will they feel it?
That's a great question. So with traditional TMS, it's like a steady training plan. You go to the gym daily and the gains start to appear gradually over many weeks and months. With SAINT, you have the 5-day accelerated. It's intense, 10 sessions a day for 5 days. And then some patients will hit remission in a couple of days, but usually a few weeks afterwards. 1 day is like planting a very intense garden in a single day. And then the garden starts to grow gradually. So you usually start to feel a shift with 1 day, starting about a week after treatment, with the optimal results hitting at 4, 6, and then 12 weeks as well.
So if this works and it's safe, why isn't 1 day being talked about?
That's what we're trying to do, but there are some major friction points. So Insurance and policy is a big deal. So most insurance plans are written around traditional once daily TMS, and they demand that you have failed multiple medications first. And even though, for example, accelerated SAINT protocols are actually FDA approved, they are not authorized by insurance. And that creates denials, appeals, delays. And so a lot of patients don't want to be on medication first. And really, TMS should be considered first line because it is so much safer. For a patient to hear you have to be sick longer before we can help makes no sense. What helps is documenting patients' prior medication failures, intolerances, and then having these conversations with insurance companies. But it's going to take a while for them to adopt and approve these accelerated plans.
Yeah, and what are some other friction points?
Awareness, education is huge. A lot of clinicians haven't even heard of TMS, let alone seeing some of these accelerated protocols. And then even within existing TMS clinics, a lot of them are really stuck in doing it the traditional way, the 36-day protocols, and not really understanding the other ways to do it. And really staffing and getting a clinic to do an accelerated treatment is a completely different animal than having once daily treatments. So that's tough. So it's just general education, and then clinician and staff training can be challenging. And then there's also the stigma of our culture. People still think of brain stimulation as shock therapy, and TMS is absolutely not ECT. There's no electric current going into the brain. There's no anesthesia. There's no memory loss. It is so safe. It is practically the opposite of ECT. So we have to humanize it and show that it's simple, it's comfortable, it's easy. And the fact patients can drive themselves home. Employers and universities also need education. So if we can allow someone to just take one day off to get better, it's so much easier than 40 visits.
Yeah, no, it sounds amazing. Can you also explain some of the breakthroughs that are going on within the TMS community right now that are really changing the game?
Yeah, so this one-day protocol that we've developed was the first center in the world to do this. So we're very excited to be the ultimate pioneers in this space. And we are now, as I was saying earlier, the largest single clinic site that has done the most TMS treatments. So we really are leading the charge here. So all of the data that we have, just not only from our original study, but ongoing patient outcomes, have really shown that everybody can finish it. There's a 100% completion rate, no serious adverse events, really strong outcomes, far superior to traditional 36-day treatment outcomes, and equal to, if not better than SAINT. And that's what insurance companies and health systems should want and ask for. We also have much simple technology now. The advent of ExoMind, which is what we use in our clinic, has made it incredibly easy for practices to bring into their clinics and a much more comfortable patient experience. And then the logistics of having a patient-first experience of just taking one day off and getting one day of childcare, one day of vacation is actually doable. And then reframing the whole way we talk about mental health and giving it a makeover, making it okay to prioritize your mental health and making that as important as your physical health.
Yeah, absolutely. So if, I'm a patient listening, for example, what are some things I can do tomorrow?
So I think ask your clinician, your primary care provider, your psychiatrist, whoever you're getting your care about TMS and the options. Find one that matches your needs and your life constraints. Understanding your medication history, that also helps if you're going through the insurance pathway. And then don't go it alone. Loop in your employer, your school, your family for that single day treatment to help get that support to get you better much faster.
Yeah. And is this just about depression, or are we looking at something bigger that can treat a whole slew of other things?
We're looking at something so much bigger. So we're already seeing so much data for incredible success with anxiety, OCD, PTSD, chronic pain, addiction, even neurodegenerative diseases like Alzheimer's. And we're learning how to combine the best elements of each model, the speed of the acceleration plus the durability of traditional TMS.
So really the dream is safe, fast, lasting relief without the compromises of meds or ECT.
That's exactly it. The more we refine TMS, the closer we're getting to treatments that don't just pull people out of crisis, but also help them thrive and focus on prevention.
Yeah, absolutely. So, really, the big takeaway is TMS used to mean 2 months of daily clinic trips, and now we're talking just one day, and it's the same safety and most likely better results.
Exactly. And the most important part is you have choices. You don't have to stay stuck. You don't have to pick between suffering and side effects.
So, parents, partners, professionals, if you've been caught in that impossible trade off between feeling better and staying yourself, TMS shows that trade off may not be necessary anymore.
Exactly. And the great part is that this is real evidence-based, validated neuroscience. This is in no way experimental. We have so much data and decades of evidence. And this is finally catching up to what people really need and have always needed. It's not just about treatment, it's about transformation.
Thanks for joining the Kind Revolution. If this gave you something real, hope, perspective, or a fresh way to think about health, please share it, subscribe, and pass it on. Medicine won't change on its own, but together we can reimagine it and build something smarter, kinder, and create a system that truly heals. This is the Kind Revolution with Dr. Nanos, where science meets compassion and the future of medicine gets brighter, one conversation at a time. Thanks for joining the revolution.